Administering liquid medications to your child can be tricky, but taking care to give them correctly is important to the health of your child. Today, we will present to you an easy way to remember the tools needed to give medicines to your child. The 3 R's: right medicine, right dose, and right time.
Right medicine. When your child is prescribed a medication, it is important to be comfortable with how to read the label. Be sure the medicine is labeled with your child's name and never give your child a medicine labeled for someone else. Here is the name of the medicine, and this is where you can find the dose. Remember that all medications should be kept in a safe place out of the reach of small children. Always store adult and child medications in separate areas. This will decrease the chance of mixing up the containers by accident. Be sure to read the label carefully to find out how your medicine should be stored. If your medicine needs to be kept in the refrigerator, put it on a high shelf towards the back so that your child can't reach it. Also, be sure to see if your medication requires shaking before measuring. Right dose. Giving too little or too much medication may be harmful to your child. If you give too little, your child's illness or disease may not be treated appropriately. If you give too much, your child may have harmful side effects or run out of the medicine too early. There are many kinds of tools to use to administer liquid medicines. Some common ones are dosing spoon, syringe, cup, and dropper. Always use the dosing instrument that comes with the medicine. If a medicine does not come with a dosing instrument, or you are uncomfortable with a particular device, ask your pharmacist to recommend one. Store the device and the medicine together. Remember, you should never use a kitchen utensil such as a spoon to measure medications. Spoons come in a variety of sizes, which makes it impossible to measure accurately. For over-the-counter medicines, it is important to know your child's weight, as the medication dosing for children is based on weight, not age. If you need help figuring out the right dose, always call your child's pediatrician. To give a medicine, follow these steps. Make sure when measuring liquid medications you are not distracted and the room is well lit. Check the label to verify the dose. It may be marked in milliliters or teaspoons. After you see how much medicine you need, draw up or pour to the correct line. When measuring the liquid medication, always be sure to look at it at eye level. With dosing cups, measure on a flat surface and not while holding in one hand. After measuring liquid medications, immediately replace the cap. Administer the medication to your child, being sure to give the full dose, which is often best accomplished by placing the device toward the back in the mouth. Right time. Be sure to administer the doses at the right times every day by reading the label carefully. If there are multiple caregivers who will give your child the medicine, keep a simple chart on the refrigerator to keep track. Remember, correctly administering liquid medications to your child is an important skill. By ensuring you are using the right medicine, right dose, and right time, you will keep your child safe and healthy. If you ever have any questions about medications, call your pediatrician for help.